per day on average, and now it seems to be well below 10% per day and getting actually closer to 5% and hopefully stabilising there. So a cautious level of optimism there, and that is really down to the terrific work of all of the Australian people who have been abiding by our social distancing measures that have been put in place by the federal and state governments. So a very big thank you to everybody who's undertaken that and doing the right thing to ensure that we can hopefully maintain that very low growth rate and continue to get it down even further. Just in the same breath, can I also make a particular shout out to the multicultural communities. As the Acting Immigration and Multicultural Affairs Minister, I've been engaging with multicultural leaders constantly in relation to the measures which we've been announcing, and they have been terrific in supporting us, getting the messages out there, and the multicultural communities, just like all other Australians, have been playing their part to ensure that we can get that infection rate growth down. And we need to all collectively continue this effort, but I specifically, as the Multicultural Affairs Minister for the moment, wanted to thank them for their contribution. Today, I'm announcing some changes to temporary visa arrangements, which will be in operation during the corona crisis. There's 2.2 million people in Australia on temporary visas, and they come here for a variety of reasons. Some to visit their family and to tour the country, some to study here, others to fill job shortages, and for all sorts of other reasons. But they are given a visa for a short period of time, sometimes as little as a few days, but sometimes a few years. But because of the crisis, we've had to make some changes to these temporary visa holder arrangements. Before going into the details of the different various classes, I want to take you through just the broad principles upon which have guided the changes which we're announcing today for the temporary visa holder arrangements. The first principle is that Australians and permanent residents are our primary focus. Now, they're our primary focus for the work which is available and for the welfare which we are making available. Now, our focus for the Australian jobs must be for Australian citizens and residents. Our focus for Australian welfare must be for Australian citizen and for residents. That's our first principle. Our second principle has been that there's always been an expectation that temporary visa holders are able to support themselves, and that expectation remains. Now, we are going to make that easier for people who have already done some work in Australia by allowing them to access their superannuation while they're in Australia to help facilitate their stay here if they are in financial hardship. And that is similar to the arrangements which we've already put in place for Australians to be able to access their superannuation. But if you can't support yourself generally, having put in place these measures, then you should be going home where you can get that support. Now, the third principle which has guided our changes is that in critical industries such as health and education, we will provide visa flexibility so that these foreign nationals can stay longer. Now, what does this mean? That means that foreign nurses are invited to stay here longer and work longer hours where they can. It means that foreign workers on farms are invited to stay here longer and fulfil the critical needs on the farms as well. That's what these proposals will mean. So these changes are all about prioritising Australians, being concerned for the health of Australians and our permanent residents and other people in this country, and sending a message that we ask those foreign nationals who are here on temporary visas to continue looking after yourselves, and if you are unable to do that, then to make arrangements to return home where you can get the support that you might need. Now, having outlined those principles, let me go through some of the major visa classes and the specific measures which are applied to those. I'll start with visitor visa holders. These are our international tourists. Now, there's 203,000 international visitors in Australia, and they're typically on visas which last anywhere up to 3 months. International tourists should return home to their country. International tourists should return to their home country as quickly as possible is our message, particularly for those that don't have family support in Australia. This message was stated yesterday very clearly by the Prime Minister. I reiterate that point today, that international tourists should return home, particularly if they don't have family support in Australia. Now, thousands I know are already doing this. I see that in the data, and others should be following their lead. In relation to international students, we've got almost 600,000 international students in Australia, many studying in the higher education or vocational education sectors. And these people have been a terrific contributor to our tertiary sector and our economy, and they support hundreds of thousands of jobs by being here. Now, we're saying to international students that we encourage you to rely on your family support, on your part-time work where that is available, and on your own savings to help sustain yourself while you're in Australia. We know that as part of your visa application, you're required to demonstrate that certainly in your first year of being a student, that you can support yourself. And so our expectation is absolutely that if you're a first year student, you're able to support yourself. But if you are unable to support yourself, then you might need to consider other arrangements. In relation to second and subsequent year students, as I said, we ask you to lean on your families for their support, go into your own savings to support yourself if you need that. In addition, we will allow you to access the superannuation which you may have accumulated here in Australia as well through the part-time work which you are able to do while you are here. So that's the message in relation to international students. They have been a terrific contributor to Australia, supporting Australian jobs. We want them to stay here where they can support themselves. We're providing additional flexibility for them to support themselves. And I'll also point out that we continue to work with the international education sector on future arrangements as well. We'll get to New Zealanders now who are on what's called the 444 visas. Now, as probably people know, New Zealanders and Australians have reciprocal arrangements whereby New Zealanders can come to Australia and stay in Australia and work in Australia, just like Australians can go to New Zealand, stay in New Zealand and work in New Zealand. About half of the 600,000 or so New Zealanders who are in the country won't have access, however, to the job seeker payments. They will have access to the job keeper payments. So we're not proposing to change those arrangements. So if there is a New Zealander in the country who is unable to access those job seeker payments, then again we ask them to consider returning to New Zealand where they will be able to get their support that they need. I'll go to temporary skilled visa holders now. Now, there's about 139 temporary skilled visa holders in Australia. These are people who were invited and sponsored into Australia to fulfil really valuable skills shortages here in this country. And they're typically on either a 2-year visa or a 4-year visa. Now, we know, though, that those businesses who are sponsoring those people, many of them are doing it very tough and have had to stand down people or had to lay off people, and that includes some of these foreign nationals on temporary visas, temporary skilled visas. We're making a distinction here in terms of our measures between those that have been laid off and those who have been stood down. For the individuals who have been either laid off, I'll start with the stood down. For those individuals who have been stood down or had their hours reduced by their business owner, by their business sponsor, their visa will remain valid. It's an important point because clearly it's an indication from the business owner that they would like that person to be there and as being part of the rebuild once we're post the corona crisis. So I repeat that, if they've been stood down or they've had their hours reduced, their visa will remain valid, they can stay in the country, and we'll give them access to up to $10,000 of their superannuation. If you've been here for a couple of years already working, no doubt you would have at least that amount of money in your superannuation account. For those who have been for those who have been laid off, the normal arrangements are going to apply. That is that you will have 60 days to seek another business to sponsor you in the country, but if you do not, then the usual arrangements will apply where you will have to depart the country. That's for those who have been laid off. Let me come now to working holiday makers, the backpackers in Australia. And we have about 118,000 people in Australia on what's colloquially known as backpacker visas, whereby people can come into the country, they can work for limited periods of time, as well as travel the country. The changes we are making here relates only to the critical sectors of health, aged care, disability care, agriculture and food processing, and childcare. In relation to those critical areas, we are making changes to allow those people to work longer in those industries. Typically, they will have only the rights to work for 6 months for any one employer. However, the changes we are announcing today is that if you are working in one of those critical industries where we know we need your skills, you will be able to work longer than that 6-month duration. Furthermore, when your visa expires after 1 year, if you have been working or are working in those critical industries, we will extend your visa for a further year and subsequent years should that be the case if you're already in your second year of your visa. In addition to that, myself, along with David Littleproud and the Deputy Prime Minister, have announced this morning that we'll also be extending the Seasonal Workers Program and the Pacific Labour Scheme. We will extend the rights of those people already in the country for up to an additional 12 months. These are people, relatively small numbers, who have come from Pacific Islands who are working on the farms doing those critical jobs. We will be extending their ability to stay in the country for up to 12 months. Now, of course, all of these arrangements will be under constant review. We know that this situation is changing rapidly, but we are sending the signals out today in relation to the changes which we are making, the flexibility that we are providing, but also setting that expectation for those people who are foreign nationals here on a temporary basis, that if you cannot support yourself in Australia, then please consider departing the country, going home where you can get that support. I'm happy to take any questions.
So if someone's on a working holiday visa and they're, for example, a qualified nurse, would they be able to work in that industry rather than just in fruit picking? Would they be able to change the industries they're working in? Yeah,
that's right. So they will already have the ability to work as a nurse, and the changes mean that if they are working as a nurse, they're coming up to the end of their visa at the end of 12 months. We will roll that visa over for a further 12 months should that person want to stay. And obviously we'll be encouraging those people who have those skills to stay.
But would they be able to transfer to a separate industry, say fruit picking, between those separate industries? Well,
it's for those critical industries where we have shortages and we know that we're going to be needing these people. If they are working in those industries now, they will have the ability to stay and they'll have the ability to extend their visa. So, of course, that also means that if they're still within their first year, still within their visa rights, which goes for a year, they can go and work as a nurse. If they're working as a nurse, they'll have the ability to extend for a further year.
You mentioned for visitors who can't sustain themselves, they should leave, and the PM made that quite clear yesterday. Are you considering terminating visas to people in those situations to force them to leave?
I can see from the data that people are already taking this step. We've had an enormous number of people who have already taken flights over the last few weeks, knowing that they can get better support back home. So our simple message is precisely as the Prime Minister said yesterday. For international tourists, take the next flight home, particularly if you don't have any family support. And there are many flights to be able to get you home. For example, the largest source of tourists in the country at the moment are from the United Kingdom. From the United Kingdom, next week alone, there are 150 flights to London. So there are those options for people to be able to get home, and we ask them to exercise those options, particularly if they don't have family support here in the country.
Is there anything else, though, that you can do other than ask them, particularly for those people who are backpackers in city backpacking hostels, unable to pay their bills and not prepared to go regional?
Well, if people are in the country, such as a backpacker, and they are unable to support themselves, then they need to return to their home country. That's the simple message. And if they're refusing to do that, then their visa will expire, then they'll be in breach of their conditions. And then they'll be asked, then they'll be required to leave the country.
But you're not considering bringing that forward. There's just no help, and then their visa will expire and then they'll have to leave.
They are able to stay for the duration of their visa. So a typical backpacker is on a 1-year visa with the option of extending it if you're working in critical industries, which to date has only been in the agricultural sector. If your visa is still valid, of course you can stay in the country. But you need to be able to ensure that you can support yourself. And if you're not confident about being able to support yourself because your work has dried up in the cities, then you need to be taking a flight home. That's the clear message. I'd also say a very clear message to those backpackers who may not be adhering to the social distancing rules, and we've seen some of these in the media to date. A, that you'll be in breach of state law for doing that and you can be fined. But B, you will be breaching your visa condition. And if we find that out, we will be kicking you out of the country. And then that will be a mark against your name as well for future visits to Australia. So this is deadly serious. For those backpackers that are here, they must abide by those social distancing conditions. Otherwise, they'll put at jeopardy any future visits to Australia.
Can you just go over what the critical industries are, just for clarity?
So the critical industries are outlined in my press statement, which is already being issued. Just wait 1 second so I can be... health, aged and disability care, agriculture and food processing, and childcare. Those are the critical industries which we've identified. So if people are working in those sectors, then they have additional work rights.
I've just got some questions about mercy flights for Australians who are overseas. Can you tell us what the government is doing in that sector?
That's been organised, to be honest, by the Foreign Minister and by Peter Dutton, so I'm not across the details, but you might put those questions to them. Thanks very much, everybody.
The first thing I want to say is
per day on average, and now it seems to be well below 10%.
The first thing I want to say is about the data of the day. So 5,544 cases so far in Australia, and unfortunately 30 deaths. So we've had an increase again over the last 24 hours. The good news about that is that the daily increases are definitely less than they were a week or so ago. And that really talks to the effectiveness of some of the some of the ways we have tried to deal with the virus over the last few weeks. But I want to talk about that data. That's still, even though that is an improvement in terms of the numbers of cases that are coming every day, there's still about 250 people that are contracting the virus, and still 5 people that have died in the last 24 hours. These are real people, real examples, and it really talks to why we are being so tough in relation to some of these really quite large changes that have happened in our lives over the past few weeks. It also, the other issue I'd like to mention there is that anything we try to do to slow the spread of the virus does take some time before we can be sure that that's making an effect. So much of the decrease in the daily cases we've seen in the last week are really to do with what we did at the border 2 or 3 weeks ago in relation to decreasing people coming into Australia, decreasing that travel-related push of virus cases in the community. And that is about the biology of the virus. It is, there is a period between being infected and being diagnosed with the disease, and it's about a week. So it generally will take 2 or 3 weeks after introducing a measure before we see the full effect of those things. So at the moment we're tracking quite well. That flattening of the curve we've talked about for some time now appears to be happening, but I really would caution thinking that we've got through this completely, because we definitely have not. And we really have to be hyper vigilant now in collecting the information and making some decisions about what that means in terms of the people that are getting infected, the people that are getting sick, those that are using our hospital system, those that need to be admitted to intensive care, and so on. That some of these restrictions are very, very tough, and I think it's incredible and extraordinary how Australians have embraced these different ways of living. Even in my own family, I know that my nieces and nephews, for example, very, very active, some of them in their early teens, and they have on average had 30 hours of sport a week, and they're no longer able to access those team sport events. And so they're looking for ways that they can deal with this at home, looking at ways to keep physically active, but also to take advantage of the 30 extra hours a week they have to interact with their family. So these are important things. Many people have been separated from loved ones. In my own family, there are people in New York, in the UK, in Italy. They cannot be seeing their parents at the moment, my siblings. So these are tricky times. My own daughter has lost her job, so these are real events affecting us, both from the virus itself as well as the effects on our society. And is a difficult balancing act, which will continue to be led by the data and the information that we're gathering, our experiences we're gathering from other parts of the world who are some months ahead of us in terms of the virus and the epidemic, and that advice will go to government, and those decisions will be made on a regular basis. So I think the only other thing I would like to mention, because it has been making quite a lot of news overnight, is in relation to mask use, and the CDC, Centers for Disease Control and Prevention in the US, have made some advice about the US situation and the use of masks in the community. We've been talking about masks a lot here, and particularly in relation to masks and their use in healthcare. And we really, from our national stockpile perspective, had made some gains there in terms of supply coming from overseas, and also building up the capability in Australia to make our own masks. These are very important, crucial steps to make sure that our healthcare workers on the front line are feeling safe about caring for people with this highly infectious disease. That's incredibly important, and that will remain our focus. In terms of mask use in the community, I would stress again at the moment, we do not think that is a good idea, partly because of that constrained supply, but also the effectiveness in relation to people walking around with masks. The key point there, masks can be useful to stop the spread from a person with the disease to other people if the mask is used correctly. That's true. And secondly, if the mask is a mask that is manufactured in the way that we support it from the Australian standards. But at this time, our advice remains: if you are sick, stay at home. If you are sick and you need to seek, for example, health professional support, please ring ahead. And there'll be appropriate ways of dealing with that safely when you get to the fever clinic, the emergency department, or wherever it is that you are going to, your GP, for example. So for the moment, mask use not recommended for the Australian public, and we can continue to look at ways, and indeed we are actively looking at ways of thinking about masks use into the future. So I'll leave it there, and I'm happy to take questions.
Just to explore that mask question, Dr. Kelly, are you saying that even when supply reaches an adequate level, that it could be readily available for community use, there's almost a psychological or behavioural reason why you, don't see Australia going down the US path?
So it's a slightly complex question, but I think the first thing is the constrained supply, so let's leave that one aside for now. If we had unlimited numbers of masks, I think it would be important to have a conversation with the Australian community who, unlike many countries in Asia where it's very commonly used to wear masks for a variety of purposes, partly pollution related, but also issues of personal hygiene and so on. This is not a way that, in general, Australians use masks, so there's that side of it. The second side is using a mask incorrectly can actually make it more dangerous. So, for example, if you're not used to wearing a mask, it can become quite uncomfortable, even claustrophobic, and indeed can make one it can become quite itchy underneath the mask. And so, touching a surface with the virus, scratching yourself underneath the mask could in fact increase your risk rather than decrease your risk. So if we got to that point, then certainly there would be a need for a strong conversation and about how to fit a mask properly and how to use it properly so that it would be used safely and effectively.
There's been news out of China that they're reopening wet markets. Is that a prudent move, or does that risk further outbreaks?
Wet markets are common in China and many other parts of Asia, including Southeast Asia. Wet markets are places where live animals are for sale, and there's various reasons for that, cultural as well as practical ones, in places without a great deal of refrigeration, for example. Those decisions will need to be taken by the countries concerned. I have been involved in the past looking at avian influenza, for example, and outbreaks in Indonesia and other places. And certainly there are ways of making wet markets safer. But in general, as we've found with this particular outbreak, a so-called zoonotic outbreak, a virus that has spread from one type of animal, other types of animals into humans, wet markets where there are a lot of live animals in close proximity to a lot of humans increases that risk. But in terms of this particular virus, the Covid19 virus, really that jump from the other animals to humans has already occurred, and so the major risk really is in large numbers of humans coming together rather than the markets themselves at this point.
There is noticeably cooler weather sweeping through the southeast of Australia, even talks of snow on the Alps. As far as survivability, either airborne or on surface, is there anything you can tell us about temperature ranges that may or may not affect the virulence of this disease?
So the SARS-2 virus, which causes COVID-19, is a respiratory virus like flu, like cold viruses and others. We know that during the winter months this tends to be to transmit more easily, and there's a range of factors related to that. One of the factors we have dealt with in terms of the social distancing measures, that's indeed us tending to congregate together inside in larger numbers during winter than we do during summer. And so that won't be the case in this winter, and indeed some of our early surveillance in relation to the flu season, which we've started earlier this year because of the COVID-19 issue, is demonstrating that the influenza-like illness surveillance, this is a series of questions that's put to people in our flu tracker survey, and I would encourage people to join flu tracker, have a look at it in your search engine, and you can sign up for a very quick 15-second survey every Monday asking you if you've been sick with flu-like illness in the past week. That is demonstrating that actually it's decreasing since these social distancing measures have come in, and in fact is at the lowest level that it's been for some years at the moment. So that's one side. From the winter perspective, we may well show that we are having less problem there because of that social distancing. But on the other side, we do know that low humidity and low temperatures do tend to promote the infectiousness of respiratory viruses, and we suspect that this particular virus will be similar.
And just on social distancing rules, what's your advice to people in situations such as residential colleges or boarding houses where it's not a family gathering per se, but people are co-living in the same space? Should they be socialising together?
Well, I think they should be examining the way that they live in those circumstances. And I understand that many boarding houses around Australia have closed or are planning to close shortly in relation to the Easter holidays. And that's a good thing, I think, in terms of the boarding houses related to schools. Communal living is a challenge in these situations. We've seen already outbreaks in cruise ships, for example, also backpacker hostels and so forth. Anywhere where there are larger numbers of people living in the same place, it is more challenging to have this social distancing. But there are very practical things that can be done in relation to increased hygiene, hand washing and so forth, as well as thinking about how to keep that physical distance. So coming into the kitchen at different times, for example, making sure surfaces are also clean between use and the like, where and I'd say the same as I was talking about my family in relation to the way that people are living. People are making these adjustments all the time, both in their workplaces and at home. A shout out to the hairdressers that are working through that as well in terms of social, not so much social distancing. You can't do that when you're cutting someone's hair, but the hygiene measures I've seen very practical and well done for people taking those messages on.
The health minister's announced that the government sourced 2,000 courses of hydroxychloroquine, if I pronounced that correctly. How will those be used, and is that safe to distribute across the country?
So hydroxychloroquine is an anti-malaria drug originally. It's been around for a long time, at least 50 years. It's and used as a way of preventing malaria and indeed treating malaria. Over the last few years there's been a lot of resistance in malaria, so it hasn't been used as much. It has some other uses in relation to arthritis and some other conditions. So it's important that hydroxychloroquine is not wasted. At the moment it's an experimental drug, and there are some clinical trials that have started in Australia and elsewhere in relation to this. Some early work done in France is positive, but very preliminary. So to answer your question specifically, those drugs are aimed to be part of controlled clinical trials to make sure that this drug is safe to use and is effective. Okay, thank you very much.